I've always loved to be active. I played volleyball a few times a week. I run, that's my main activity. Lift weights, ski, golf, just anything that I could do to be outside. One time when I was playing volleyball, I went for a dig and I felt a pop in my knee and it swelled up and I felt pain, and so I did the things that I was supposed to do to try and control that. It helped, but it didn't, of course, cure it. I decided to go get it checked out by a surgeon, a knee surgeon. He had me do an MRI, and then when I went back in for the diagnosis, I had a partially torn ACL, a couple of meniscus tears, and some arthritis in that knee. And he recommended a full knee replacement. And I was like overwhelmed by that. I didn't expect that diagnosis at all. And I didn't agree with it. Decided to get a second opinion. So I went to another knee surgeon. He recommended that I get the ACL replaced and get the meniscus tears trimmed. He also said that I would probably have arthritis from that, and maybe a little arthritis pain as I got older. He also talked about doing some PRP and some stem cell, and I hadn't really heard about that, so I asked him some questions about that, and he gave me a little bit of information. And with that information, I decided to do some research. So I researched all the possibilities. I researched having knee replacement, partial knee replacement, the ACL fixed, the stem cell. I did everything, and I felt like stem cell was an interesting option, but it seemed like a little wild card to me. It didn't feel like it was medically. It felt like there were lots of different options for it. And so I continued to research that, and during my research I came upon the Regenix method of stem cell, and that was very interesting to me. I felt like that was really something that would work for me. I found that there were some clinics around. There was one in Denver and one in Salt Lake, and I actually called the one in Salt Lake and talked to a gentleman for quite a long time, and he answered a lot of questions about Regenix. One of the best things that I liked about Regenix was that the doctors are trained in the procedure, and so they've had experience. It's not just we'll try it and see how it works type thing. They also give you a rating from poor, we don't think this is going to work very well, to fair, maybe, to good, to excellent chance of recovery. And the other thing I liked is that it's the stem cells injection is guided. And so there's an ultrasound which the doctor can put the stem cells exactly where they need to be. And so we thought about going to Salt Lake to do that, and I decided I would just see if there was anybody around in Idaho Falls that had any experience with that. And so when I got to Dr. Vlack's website, I saw the Regenix logo, and I was really excited about that. My husband had had some PRP with Dr. Vlack a few years ago on his knee and had good results, so we trusted her. We knew that she was very professional and had great qualifications. And so I made an appointment with Dr. Vlack. She evaluated my knee, evaluated my MRI, and I love that she looked at my knee as a whole knee. She had me do strength exercise, or some strength tests. She checked it out really thoroughly, something that the other doctors really hadn't done. They just kind of looked at the MRI and then given me their results. So she checked my knee out thoroughly. She told me she thought that I had an excellent chance of recovery using stem cell therapy and PRP. So I decided to go ahead and make the appointment. The things I liked about the clinic, I just felt like it was so professional. I had no no questions. Any question that I had was answered. Everyone was concerned about how I was doing. They were always taking my vitals. They were making sure I was the right candidate for the right thing. Dr. Vlack explained everything perfectly. I had no questions about what was going to happen that went unanswered. She not only told me what to expect, but I received written articles about it. She encouraged me to do more research so that I felt more comfortable with it if I had any questions. So I went ahead with the procedure. It was everything that I had been told it would be. It was not uncomfortable. It was, there was protocol that I was asked to follow before my procedure and after. And I'm a pretty good rule keeper, and so I've been very diligent about doing what I've been asked to do. I received some very easy exercises to do that I started right after the procedure. Then I was sent to a physical therapist. They were wonderful. They helped me learn what I could do and what I couldn't do, and when I should do it and when I shouldn't. One of my goals was to be able to climb stairs without pulling myself up. I couldn't, after I had this injury, I couldn't go up and down stairs normally, and I just thought if I could only do that, I would be so happy. And the day that I was able to climb stairs normally was just a great day. And since then, I've just continued to get stronger and feel better. I have zero pain. We actually treated both knees, ended up treating both knees. I have zero pain in my knees. I have just been, it's been a little over 3 months, and I've been released to be able to start running again, which I'm really excited to work up to. And I can take long walks without pain, and I've just had a great experience with this procedure.